disparities, especially, in a place like New York City where there's so many different demographics. Why is it so important for you to have a practice like this in Harlem?
Yeah, so it's funny when we think about disparities in general, a lot of times we would think about global disparities, right? But the reality is a lot of the issues are actually here at home. Specifically in New York, one thing that I've noticed is some communities they completely, lack proper dental services. And so one of the things that we've done with SmileSpace, we go into the community and provide high quality, luxury dental experience for the people in the community.
Why is oral care so important? When you look at all of the different offerings when it comes to healthcare, dental care kind of seems like the expendable one. Like if I have to have, my vision and my overall health, okay. But if I can lose one of those, maybe I'll not go to see the dentist.
Yeah, for some reason I think a lot of people disconnect the mouth from the rest of the body. And the reality is a lot of the issues that manifest in the mouth can actually affect, other parts of the body. And people don't understand you can actually die from an infection in the mouth. And so I think these days, maybe with social media, people are just more aware. I think the conversation is changing around oral health in general.
Mm-hmm. Tell us about your practice here, the two practices that you have in New York City. When did this one open, and then your other shop in Brooklyn?
So this one in Harlem actually opened in November of 2023. I had to think about what year we're in. So 2023. The practice in Brooklyn actually opened in October of 2020 during the pandemic. And, it's a crazy story, but I signed a lease for that practice in December of 2019. Construction started in January, and then the world shut down in March. And of course, New York City was the epicenter of the pandemic. And so I think the odds were stacked against us, but with my team, we did a really good job of just providing an elevated experience for people. And I think during the pandemic, people were really looking for spaces that were safe. And the fact that we were new and modern, I think people really just trusted that we had the most up-to-date infection control protocols in place.
Right.
And so that practice just grew really quickly.
Talk a little bit about the impacts of having a facility like this, in a location like this, ran by someone that looks like you with a background like yours. For those in the community that come in and see this beautiful facility, and what it really means, the symbolism of it, the impact of it. Talk a little bit about that.
Yeah, I think sometimes I have to take a step back and really think about that, that point. Because, really what we do here is we're just doing the work that the people need. But the fact that this is a Black-owned, high-quality luxury experience right in the community is something that, people really do appreciate. They walk by both practices in Brooklyn, they're like, it's beautiful, it's the most beautiful practice I've ever seen. And so I'm fortunate to have a facility that can cater to people while providing that luxury experience. This practice could be anywhere. This practice could be in Soho and do well. But it's been super important for me to be here with the people and to provide those services to our people who look like me.
Oh, I'm so curious to know about the numbers of how many people just walking by and seeing that this is right here in their community, it's in Brooklyn. If there's more people that are now inclined to come in because they have the access to get those dental services that maybe wouldn't be able to.
That's exactly right. That happens a lot. So people will walk by, they'll assume that we don't accept their insurance, they'll assume that we are fee for service, that they'll have to pay out of pocket, that we're expensive. But the reality is, when they walk in, they see that, we accept most private insurances, and we're really here to serve them. So, super important to me.
Do you have any specific programs for people who, maybe need a little more assistance in getting those services?
So we're working on that.
Mm-hmm.
A lot of times when people come in, if they don't have insurance, what we'll do is guide them to a broker that can help them sign up for an affordable plan, right? So a lot of people, again, they assume if we don't accept the insurance, then they can't come.
Mm-hmm.
But we do everything in our power. We have a good administrative team that can help guide people in that direction. Yeah.
So let's talk about the accessibility when it comes to these luxury services. We've seen veneers taken off across social media.
That's right.
Something that was kind of once reserved for maybe people who are in their latter years, who need, a little assistance with their dental hygiene, to people who just have the money and the access to get these services. But now we're seeing anybody be able to, almost anybody able to get veneers. Can you talk about the impact of that, what you've seen in your practice, what you've seen, you know, in terms of inquiries and across social media regarding cosmetic dentistry?
Yeah, I think social media has played a big role in, you know, the increase in the number of people that get veneers. People don't really understand what veneers are, so I'll break it down to you. So there are two different types of veneers. You have composite veneers, which are, you know, we pretty much use like a filling material and we bond it to the outer surfaces of the teeth. The benefit to that is we don't necessarily have to shave down any natural tooth structure. We don't have to remove any natural tooth structure. So that is very appealing to people, but the downside is often the composite veneers look very big, bulky, you know, like chiclets. I hate to use that word, but that's what I think of sometimes when I see some of these veneers. If they're done really well, they don't always look bad, but as a dentist, I can see that, you know, it's composite, it's not the most ideal material. The other downside with composite veneers is that they actually stain and chip, and so a lot of times they need to be repaired. People don't understand that there's a lot of maintenance that goes into that. And you have to follow with your dentist, I think, even more often than with a patient that does not have veneers. So normally we recommend coming to the dentist every 6 months. I think when you have veneers in general, you should come more often, probably every 3 or 4 months.
Okay.
The other type of veneer is a porcelain veneer. And so porcelain veneers tend to be a little bit more expensive. But the benefit is that porcelain typically, so it doesn't stain, it's a harder material so it doesn't chip as often. And we have to remove a little bit of your enamel, but the truth is, you know, in doing that, you know, the teeth actually look more normal. And you know, those veneers are made by a lab technician, so it's like a 2-visit process. Whereas like the composite veneers are pretty much designed in the office by the doctor.
And what's the price difference? So on average, composite veneers cost, they start at how much?
Are we talking about in America or?
I know, America.
In America? So composite veneers, I'd say probably per tooth, probably 500. Right?
Per tooth?
I think so. I think
Okay.
that's a good. I personally don't do them for the reasons that I explained before.
Right.
I don't want to get married to these issues, these complications that come along with that. And then with porcelain veneers, we'll probably charge around, let's say $2,000 on average for one veneer. So there's a significant price difference, but per tooth, but it's an investment. And of course, if you want quality, sometimes you have to pay for the quality.
Let's talk about
That's
that,
what it
because
is.
like you said, there's a cost here and the international cost, right?
That's right.
What are the risks in going the international route? I mean, people do say that there are some, you know, safe facilities abroad if you want to, you know,